Barbra is the CEO of My Menopause RX. She's a gynecologist and women's healthcare specialist and creator of the online doctor's office for menopause care. She's speaking with us today about why menopause matters, providing evidence-based care while decreasing healthcare costs. Welcome, Barbra.
Why, thank you so much. So today I'm going to present why menopause matters, providing evidence-based care while decreasing healthcare costs. As Anna mentioned, I'm a gynecologist and a certified menopause practitioner. In addition, I am the founder and CEO of My Menopause RX. Thank you so much for joining me today. I'm excited to share my thoughts on menopause and why it matters for midlife women. So in today's presentation, I'm going to discuss menopause and the cost of untreated symptoms, compare the in-office menopause visit to a virtual menopause visit, and present our value-based solution for menopause treatment. The healthcare market for virtual care is white hot, especially in the United States, where I'm from. And I'm excited that it's finally deserves and is getting the attention that's needed for menopause treatment. Until recently, changes in the healthcare delivery landscape have moved at a snail's pace. But fortunately for the FemTech industry and midlife women, the recent pandemic has quickly opened the mindsets of patients, healthcare providers, and lawmakers to accept alternative models for the delivery of healthcare. So why does menopause matter? Well, menopause is a quiet healthcare crisis. Untreated menopause symptoms are expensive for women, patients, healthcare systems, insurers, and employers. And many midlife women live in healthcare deserts without any access to specialty care. All women transition to menopause either naturally or surgically, and worldwide, by the year 2025, there will be 1.1 billion postmenopausal women. But in addition, menopause increases a woman's risk for chronic disease, cardiovascular disease, high cholesterol, diabetes, osteoporosis, anxiety, depression, and sexual dysfunction. And chronic disease drives up the long-term cost of healthcare. Menopause symptoms often go unrecognized. This is due to primary care providers and OBGYNs in the United States lack formal menopause education. Hormonal changes and menopause symptoms can begin in a woman's 40s and often go unrecognized. And women at midlife, because of this, are missing prime healthcare opportunities to decrease associated chronic illnesses and have the opportunity to improve their wellness. Many midlife women are at the peak of their careers. Women notoriously put work and family above their own health and need convenient, affordable solutions and access to menopause specialists. Menopause symptoms masquerade as other medical conditions that is confusing for both patients and the untrained clinician. So I'm not going to go through all the symptoms because there are so many, but I invite you to go to our menopause quiz at mymenopauseScore.com. So untreated menopause symptoms are expensive, and that's why we're talking about healthcare delivery. In fact, $1,336 per woman per year is the cost of additional healthcare expenses for untreated symptoms. And it's not just expensive for healthcare providers and health systems, it's expensive for employers. $770 per woman per year is lost in economic costs due to menopause. And so while these numbers alone are powerful, it does not take into account the additional unrealized costs of the chronic health conditions associated with menopause that I pointed out earlier. So why talk about value-based menopause care? We've discussed how untreated symptoms are expensive and go unrecognized, but now we need to discuss how we rein in those costs but yet maintain quality. Traditional office visits are expensive, inconvenient, and lack price consistency. In the United States, every healthcare provider and healthcare system in the US has a private pre-negotiated reimbursement rate that are usually unknown to the patient prior to their visit. Utilizing telemedicine to treat menopause improves access to care, decreases overall costs, yet maintains quality. Menopause treatment does not need a physical exam. I can personally attest to that as a midlife woman and a menopause provider. Menopause requires listening and discussions with patients. Value-based menopause care must identify women early in the menopause transition, which is called the perimenopause, offering education, lifestyle interventions, and treatment when necessary. It must utilize telemedicine as a value proposition to divert care from unnecessary, expensive in-office visits. And we must control ancillary costs by utilizing end-to-end integrated specialty care telemedicine platforms. Most of all, we must treat women holistically. The menopause transition not only impacts a woman's physical health, but also her mental health. Virtual care platforms cost less. In this example, we've taken the average Midwest reimbursement rate for a typical in-office visit is $180 to $249. At My Menopause RX, we have been able, using our integrated end-to-end platform for telemedicine, to reduce the final cost to just $99. That's a large savings on a per visit platform of $115 for patients, health systems, and insurance plans, all without sacrificing quality of care. Value-based menopause care does not equate to inferior care. By using here in the US, certified menopause practitioners from the North American Menopause Society who follow NAMS protocols that set the standard for menopause, we maintain quality. Menopause practitioners identify and understand the symptoms associated with the hormonal changes in women at midlife, and they avoid unnecessary expensive medical workups and lab testing. For menopause telemedicine to truly become mainstream, patients and clinicians need a satisfying care experience. Patients must enjoy the same level of menopause care, but yet without leaving their home or place of work. And patients in healthcare deserts must gain access to the menopause care that they were lacking. Patients must feel that their complaints have been addressed, and providers must feel that care modality easily enables them to holistically care for their patients. So how does telemedicine improve the impact and the clinical experience? Utilization of integrated health history intakes and system questionnaires afford women a non-confrontational method to express their most intimate midlife concerns. They serve to break the ice on what can be embarrassing conversations for many patients to initiate, especially sexual complaints. And they direct clinicians to touch on the complaints that are pre-identified by patients as important, improving overall patient satisfaction. Using audio, video synchronous visits most closely replicate the in-person office visit, which most midlife women are comfortable with as a care model. The live interaction, where patients can ask real-time questions and be answered by menopause specialists, serves as a meaningful healthcare encounter. And the capabilities must be easily accessible on the patient dashboard without having to download additional cumbersome resources or apps. Midlife women are busy. Not every woman in the menopause demographic are tech savvy, so user-friendly solutions are an absolute. So this slide represents the care flow of an in-person visit versus a virtual visit. And there's a few points that I'd like to point out. The end result is the same. We come up with an evidence-based treatment plan, whether it's in-person or virtual. But virtual care eliminates the time wasted in the waiting room, average of 41 minutes, which is a long time for a woman. It eliminates ancillary medical staff and the additional costs associated with them, and it decreases the overhead by eliminating the cost of maintaining a physical location, yet we all in all provide the same health visit outcome. So in summary, identifying women in menopause and perimenopause and treating symptoms with evidence-based care decreases the overall healthcare cost. The integrated end-to-end telemedicine platform, such as the one we created at My Menopause RX, offers an inexpensive solution to the menopause healthcare crisis without sacrificing quality. Women are thirsty for menopause education and treatment, helping them improve their quality of life with improved access to evidence-based care just makes sense in this day and age. Thank you so much for listening. I look forward to the Q&A.
Thank you so much, Barbara. That was fantastic. I've been frantically making notes to ask you in the Q&A. And please, everyone, do remember, if you have any questions for our panelists, do pop them into the Q&A or into the chat, and I'll post them to everyone.